For decades, women facing the realities of intimate aging have essentially been handed a tube of superficial lubricant and told, well, this is just a part of getting older.
Right, just deal with it.
Yeah, exactly. But what if that wasn't true? I mean, what if you could take the highly purified DNA from a salmon, combine it with a spun-down vial of your own blood, and actually, reverse the biological clock of your tissue?
It sounds totally wild, like science fiction or maybe some bizarre alchemy, but it is currently at the absolute cutting edge of regenerative medicine. We are moving far, far beyond simply managing discomfort.
Welcome to this deep dive into the source material. Today, we are looking at a stack of fascinating sources for you. We've got clinical studies, medical spa protocols, and peer-reviewed research papers on tissue regeneration.
Yeah, really dense stuff today.
Very dense, but so fascinating. Our mission for this deep dive is to unpack a highly specific, cutting-edge procedure. We are exploring the biological synergism of combining intimate polynucleotides, which you'll hear us call PN, with autologous blood-derived platelet treatment, which is commonly known as PRP, in a single session.
And to set the baseline for you here, both of these treatments have a really robust history on their own. Like you might be familiar with platelet treatments being injected into knees to repair joint damage.
Right, sports injuries and stuff like that.
Exactly. Or polynucleotides being used in facial aesthetics for skin rejuvenation. But taking these two powerhouse treatments and combining them, specifically in intimate vulval vaginal areas, it represents a massive paradigm shift in women's health.
It really does.
We are talking about physically rebuilding degraded tissue from the inside out, not just masking a symptom.
Okay, let's unpack this, because before we can understand how they work together, we need to understand what these two distinct biological agents actually are, right? And, how they behave when they're flying solo. Let's start with the platelet treatment, the PRP. When we say autologous blood-derived, we're talking about a process that starts with the patient. Right?
Yeah, exactly. That autologous label just means the material originates from your own body. So a clinician draws a small sample of your blood, much like a routine lab test.
Right.
That vial is placed into a centrifuge, which spins the blood at incredibly high speeds. The centrifugal force separates the red blood cells, which we don't need for this, from the plasma. What we are left with is a highly concentrated layer of platelets.
Which is interesting because I think most of us think of platelets as the things that, rush to a paper cut to form a scab and stop the bleeding.
Right. They do handle clotting. But in the realm of regenerative medicine, we are interested in their interior payload. Platelets contain tiny specialized structures called alpha granules.
Alpha granules, okay.
Yeah. And when these platelets are injected back into aging or damaged tissue, they break open and release those granules, which are essentially packed with vital growth factors. The sources list several key players, like PDGF, TGF-beta, VEGF, and EGF.
Let's pause there, because a list of acronyms can easily blur together for anyone listening. What are these growth factors actually doing once they are released into the tissue?
Good point. Let's single one out to show you the power here. Take VEGF, for example. That stands for vascular endothelial growth factor. Its sole biological job is to force your body to build brand new blood vessels from scratch.
Wow.
Yeah. When you introduce a concentrated dose of VEGF into an area, it acts as a massive signaling flare. It commands the local cells to initiate an aggressive healing cascade, pushing them to multiply, create new vascular networks, and, pump out collagen.
So if we're building a house, the platelet treatment is basically the foreman on a construction site, blowing the whistle and screaming at the cells to build new infrastructure immediately.
A highly demanding foreman, yes.
Okay, so let's look at the other half of this equation. What are polynucleotides? Because the literature defines them as biopolymers of nucleotide chains, which sounds incredibly dense.
It's a mouthful. Think of a biopolymer like a microscopic pearl necklace, where every single pearl is a nucleotide, which is the basic building block of DNA. So polynucleotides are essentially highly purified fragments of DNA. And here's a detail from the clinical sources that always catches people off guard.
Oh, I know what you're going to say.
They are typically derived from the sperm or gonads of salmon trout.
Salmon trout DNA. I mean, how does a researcher even arrive at that as a medical treatment for human tissue? It just sounds so random.
It does, but it comes down to supreme biocompatibility. The DNA structure of salmon trout is remarkably similar to human DNA.
Really?
Yeah, and these fragments go through an intense purification process in a lab to strip away any proteins or peptides that could potentially trigger an immune response. So what you're left with is a pure, sterile biological agent that human tissue readily accepts.
Okay, so it's super clean.
Exactly. And once injected, they operate on a very specific cellular level by binding to cell surface receptors, most notably the adenosine A2A receptor.
I'm trying to visualize this. What happens when the salmon DNA fragments lock into that A2A receptor on our cells?
Triggering the A2A receptor initiates a profound anti-inflammatory signal. It essentially turns down the dial on chronic inflammation in the tissue while simultaneously signaling the cells to begin repairing themselves and producing a fresh extracellular matrix.
So if the platelet treatment is the foreman demanding the wall gets built faster, the polynucleotides are the architect providing the actual bricks and the blueprint.
That's a great way to look at it.
But wait, doesn't the body already have its own bricks? Like, why are we injecting fish DNA to help the cells rebuild? Why wouldn't the foreman just use the materials that are already there?
That is the core hurdle in aging tissue. Your body absolutely has its own raw materials, but as we age, our natural regenerative responses become incredibly sluggish. The cellular workers are tired, and the local raw materials are severely depleted.
Oh, I see.
Yeah, so if you inject the platelet treatment alone, you are sending a demanding foreman in to yell at exhausted workers who simply don't have enough bricks. The cells cannot keep up with the intense metabolic demand created by those growth factors. The tissue might try to heal, but it will eventually burn out.
Which perfectly sets up the need for both treatments to work in tandem. So we have this incredible cellular toolkit, you've got the foreman demanding new construction, and the tools to supply the site. But why apply it to this specific area of the body? Why is intimate tissue the frontier for this, rather than just sticking to knees or facial aesthetics?
Well, the clinical reality of intimate aging severely impacts a woman's day-to-day life, yet it has historically been just brushed under the rug.
So true.
The sources detail conditions like genitourinary syndrome of menopause, or GSM, postpartum tissue damage, and chronic inflammatory conditions like lichen sclerosis, which is an autoimmune condition that causes the skin to become incredibly thin, white, and prone to tearing.
And the human impact of these conditions is staggering when you read through the clinical observations. As women age and experience dropping estrogen levels, the structural integrity of the vulvovaginal tissue fundamentally degrades. We throw around medical terms, but the reality for the patient is severe vaginal dryness, a profound loss of elasticity, urinary incontinence, and dyspareunia.
Dyspareunia being the clinical term for painful intercourse, it takes a massive psychological and emotional toll, destroying intimacy and confidence. The tissue is literally changing on a histological level. It loses its collagen density, its vascularity decreases, meaning there is significantly less blood flow to the area, and it entirely loses its ability to retain moisture.
And if a woman went to a doctor for this over the last few decades, the standard answers were hormone replacement therapy, HRT, or just being told to use an over-the-counter lubricant. But reading the sources, the limitations of those options are glaring. Many women absolutely cannot take hormones due to medical histories like breast cancer. And even for those who do, it often isn't enough to reverse the structural tissue degradation that has already set in. I mean, a topical lubricant is just a Band-Aid. It doesn't rebuild a deteriorating wall.
Exactly. Lubricants manage the friction in the moment. They do absolutely nothing to change the biological age, the thickness, or the structural health of the underlying mucosa.
Here's where it gets really interesting. By bringing this specific combination treatment to the intimate area, injecting it into the clitoris and the upper vaginal wall, the goal isn't just to manage a symptom.
The clinical goal here is something called neoangiogenesis. This is the creation of new, healthy blood vessels. We're also looking at regenerating the localized nerve endings. It treats the root structural cause.
Wow.
Yeah, restoring blood flow means restoring the tissue's natural ability to lubricate itself. Regenerating the nerves means restoring physical sensation. You're reverting the anatomy to a state where it functions as it did years prior.
All right, so if a lubricant is just a temporary patch on a deteriorating wall, how does combining the spun down blood and the salmon DNA actually rebuild the wall? We have the what and the where. Now we need to understand the how. What is the biological mechanism happening when they hit the tissue together in a single session?
So the research refers to this as a multi-hit regenerative approach.
Yeah.
As we established, the platelet treatment provides the immediate, aggressive growth signals. It forces the tissue to wake up. But the polynucleotides provide the long-term, sustained cellular activation. The true magic happens in a biological concept called the salvage pathway.
Okay, I want to make sure we get this right for you listening, because as I was reading the sources, this salvage pathway seemed to be the absolute linchpin of why the specific synergism works so well.
It really is the defining mechanism. When the platelet growth factors command your skin cells, the fibroblasts, to rapidly divide and pump out new type I and type 3 collagen, those cells have to replicate their DNA. To manufacture DNA from scratch, a process known as de novo synthesis, a cell requires a staggering amount of cellular energy, known as ATP.
Let me try a metaphor here. It's like trying to build that brick wall, but the construction workers have to dig up the clay, fire the kiln, and bake every single brick from scratch before they can even start laying them. They are burning through all their energy just making the materials.
That is spot on. And in aging tissue, the workers pass out from exhaustion before the wall ever gets built. The cells simply run out of ATP. The metabolic tax is too high. This is where the polynucleotides step in and bypass that entire metabolic bottleneck.
Because the polynucleotides are breaking down and providing a massive ready-made pool of materials.
Yes. The injected DNA fragments break down into a local pool of nitrogen bases, nucleosides, and nucleotides. This activates the salvage pathway. It allows the fibroblasts to literally scavenge these ready-made DNA building blocks from their environment. They get to skip the energy-intensive de novo process entirely.
Okay, so the polynucleotides are like having a dump truck just drop off a million pre-baked bricks directly onto the construction site.
That's the perfect way to look at it. The cells save all that vital ATP. They conserve their energy, and they can channel it directly into laying those bricks, actually building the collagen, elastin, and vascular networks the platelet treatment is demanding.
That covers the metabolic side of things, but the sources also highlight a physical synergy between these two components, referring to a hydration matrix. The text says polynucleotides are highly hydrophilic, meaning they attract water. But how does that actually work mechanically to help the tissue?
It comes down to the molecular shape of these DNA chains. The backbone of a polynucleotide chain is loaded with phosphate groups, and those groups carry a negative charge. In biology, water molecules love negative charges. The moment these fragments are injected into the vaginal tissue, they act like molecular magnets. They aggressively pull in surrounding water molecules and trap them.
And that trapping creates the 3D gel they talk about in the papers.
Yes, it forms a dense, microscopic net in the extracellular space. This matrix does two vital things simultaneously. First, it deeply hydrates the vaginal tissue from the inside out, providing profound, long-lasting relief from the dryness associated with GSM. Second, it provides the ultimate physical scaffold for our foreman.
It anchors the platelet treatment, because if you just inject liquid platelets, wouldn't they just diffuse away into the bloodstream after a few hours?
Exactly. Without that three-dimensional net, the growth factors would wash out into the surrounding tissue relatively quickly. The polynucleotide gel physically entangles the growth factors, holding them in place and keeping them highly concentrated exactly where the degraded tissue needs repairing.
That is so clever.
It is. If we connect this to the bigger picture, this combination is documented in the literature as the metabolic efficiency hypothesis. By combining them, you aren't just sending a signal for the body to heal. You are handing the body the exact energetic savings, the precise molecular building blocks, and the physical scaffolding it needs so the local cells don't burn out from the effort. It's a bioengineered environment optimized for regeneration.
To make this tangible for you, let's take this out of the microscopic world of cellular energy and walk into the clinic.
Yeah.
What does the synergism actually look like for a patient going through the protocol?
For how complex the underlying cellular biology is, the procedure itself is surprisingly straightforward. It is a non-surgical outpatient procedure that takes about 30 to 45 minutes.
Right. It starts with the standard blood draw to get the platelet treatment. And while the blood is spinning in the centrifuge to isolate those alpha granules, the clinical team applies a strong topical numbing cream to the intimate areas to ensure the patient is comfortable.
Once the targeted tissue is numb and the platelet serum is prepped, the clinician performs a series of sequential microinjections. They're injecting both the autologous platelets and the sterile polynucleotide solution directly into the mucosa, the clitoris, the labia, and the anterior vaginal walls.
Reading through the post-care protocols and the sources, there is a highly specific detail regarding the days immediately following the procedure. It's referred to as the healing crisis phenomenon. The clinical data notes that patients might experience a temporary increase in their symptoms.
Right.
They might see localized swelling, tenderness, or discomfort around 3 to 5 days post-treatment. But wait, if this entire procedure is supposed to heal you, why would your symptoms get worse? That sounds like a complication.
It is entirely counterintuitive. It feels like a step backward to the patient, but it is actually the biological synergism successfully kicking in. This isn't an adverse side effect. The platelet treatment initiates a localized, highly controlled inflammatory response.
Which is funny because we are so conditioned to think of inflammation as the enemy.
Chronic inflammation is the enemy. Acute, controlled inflammation is the body's alarm bell. That temporary swelling and tenderness is a sign that the healing cascade has been aggressively activated. The alarm has woken up the dormant fibroblasts, the blood vessels are dilating to bring in resources, and the polynucleotides are rushing into the salvage pathway. Your local tissue is working overtime at the cellular level.
And the sources emphasize that this crisis phase resolves very quickly, right?
Yeah, it typically resolves entirely within 48 to 72 hours. The initial intense activation phase passes, and the long-term, quiet regenerative phase takes over.
The timeline of those long-term results is fascinating because patients get a phased benefit. The platelet treatment acts fast. It initiates those rapid vascular changes, meaning the patient often notices improved blood flow and increased physical sensitivity within the first few weeks.
But the effects of platelet treatments on their own can fade after a few months. That is the critical reason the polynucleotides are in the syringe. They ensure the regeneration continues long after the initial growth factors have dissipated. Those DNA building blocks keep feeding the fibroblasts through the salvage pathway, resulting in profound structural changes that unfold over several months.
The clinical endpoints measured in these studies are incredible. We are talking about tissue that is clinically thicker, highly elastic, and naturally lubricated. Tissue that literally behaves on a functional and histological level like a younger version of itself.
It restores the anatomical integrity that was stolen by time, childbirth, or severe hormonal shifts.
So, what does this all mean for you? Whether you are a clinician deeply embedded in the medical field, or you are just insanely curious about the frontiers of longevity and biohacking, this deep dive highlights a monumental shift in how we approach aging. We no longer have to view biological aging as an inevitable, irreversible decline, where our only option is to manage the discomfort with temporary band-aids.
Exactly.
Instead, we can look at aging as a structural deficit, a deficit that, with the right combination of cellular signaling and metabolic supplies, can be biologically restocked. We've explored how pairing autologous blood-derived platelets with polynucleotides creates this perfect biological loop. The platelets demand the healing, and the polynucleotides supply the cellular energy and the physical structure to actually make it happen.
And what's fascinating here is how this energy-drug fusion model effectively reverses tissue degradation in intimate areas by perfectly balancing that cellular demand with metabolic supply.
That's so.
If we can successfully hack the salvage pathway to effortlessly regenerate these specific mucosal tissues, could this exact synergistic blueprint eventually be scaled up? Like, could we use this method of conserving cellular energy to reverse the biological clock of our major internal organs?
Now there is a thought to leave you with. Imagine applying that dump truck of bricks to a failing heart or liver. Thank you for joining us on this deep dive into the source material. We'll catch you next time as we keep unpacking the most fascinating breakthroughs out there.